There's a lot of information being exchanged this week, things that are being done well here in the United States, as well as things and strategies that are doing well in other countries. I have with me now Gina Lagomarsino, who is with the Results for Development Institute. She's the managing director there. And Gina, I'm really pleased to be able to speak with you today.
Thanks, Mabel.
A part of your job is really going out into the world and finding different innovative programs that work and work well, and then provide that information to other sectors or organizations that may be interested. Is that right?
That's right. Yes, about a year ago, we launched something called the Center for Health Market Innovations. And the goal of this center is to try to improve care for the poor in the developing world. But the way we're going about it is a little bit different than some organizations. There's a lot of focus on what the public sector does to deliver care to poor people in the developing world. But if you look at the data, the reality is that actually the private sector is the source of a whole lot of care in countries in Asia and Africa. And so what we're trying to do is to try to find those innovative business models out there in the world that make better use of private sector providers and get care to the poor that's high quality and also affordable for them.
Can you provide some good examples today?
Sure. I can give you a couple of examples. I'll give a couple from India because there are an enormous number of new innovations happening in India, one place in the world among others. For example, there's a lot of innovative use of technology, and we're finding that a number of organizations are using things like telemedicine and call centers to be able to provide care to people who live in rural areas that may not have access to doctors. So for one example would be the HMRI, or the Health Management Research Institute, which is based in the state of Andhra Pradesh, which provides a telephone call center that anyone in the state can call to request care. And they get about 50,000 calls a day in that state of 80 million people. So it's a very it's a program that's serving a lot, and they're also doing it in partnership with the government. Another program in India is something called World Health Partners, which is located near Delhi, and they actually have a true telemedicine model where they franchise providers that are operating in small rural villages. And those franchise operators then can connect rural villagers up with physicians that are in a call center in Delhi who are trained physicians, and they're able to do consultations via video conference. And this is providing care to people from doctors that they would not have been able to otherwise get. And one other interesting model in India is specifically focused on tuberculosis treatment. This is operating in urban slum areas where there's a high rate of tuberculosis, and it's very difficult to get people through a full, multiple-month course of treatment. And Operation ASHA has an innovative model to use local providers of care to make sure that people stick with their course of treatment for the full multiple months, and at the end actually be cured of TB. So there's a lot of very fascinating programs that we've been able to find, and that's just an example of three. We document more than 750 programs across the world in Asia, Africa, Latin America.
And back to the call centers in India, for example.
Sure.
In terms of being able to reach a great number of people, what else stood out to you as something that really worked well?
It's interesting. Well, one thing that we try to do at the Center for Health Market Innovations is, in addition to profiling innovative programs, we're beginning to try to analyze which ones are really working well. And this is a multi-stage process, and we're in the early phases of that now. And what we are finding is that there is a lot of information now about programs in terms of the reach and the number of people that they can actually get to. We're beginning to learn more about the actual impact in terms of quality of care. And one of our goals at the Center for Health Market Innovations is to try to get better information about the results of the programs that we're profiling. Are they actually improving care? Are they actually reducing costs?
And are they?
In some cases, we have some good evidence. In other cases, there isn't much evidence yet, and so we're working to actually try to get better information so that we can identify which programs are really working the best. And the goal then, of course, is to try to find those programs that work the best and be able to scale them up in the locations they are currently in, and then also to transfer them to other countries that might be able to benefit from them. But I think the jury's still out on a lot of these to really understand how well they're working.
Yeah, I was going to ask you what happens to the information after you've gathered it.
Yeah, well, one thing we're working on is to create really a global community of the innovators. And so we have our website, healthmarketinnovations.org, is really working to reach both the community of innovators, these 750 organizations we profile, because we think there's a lot of knowledge they could share with each other. We also are working to reach out to funders, both donors as well as investors who are interested in investing in these organizations and trying to connect them up. And we're also looking to reach out to researchers, the research community who's interested in really better understanding how these models are working to serve the poor. So that's one goal of our center, is to make better connections among all these stakeholder groups so that hopefully the models that work the best will begin to get better known and begin to get more funding and then be able to scale up and serve more people.
Okay. Gina, have I covered everything that the center is most involved in now?
Yeah, I think that covers it pretty well.
All right. Thanks so much for your
Mabel.
time.
Bye-bye.
I'm Mabel Chong. You're watching continuing coverage of the World Healthcare Congress in Washington, D.C.